information, knowledge, skill to take care of their health, to be in charge of their health, in terms of making the right healthy choices. And when men, women, children, adolescents, elderly in the society are healthy, that means a productive society. Nigeria was the first to declare this National Health Promotion Day in the whole of Africa, in fact in the whole world. There's a lot of health promotion interventions borders on creating huge awareness and ensuring, and this awareness you have to do it over and over continuously for our populace, for our people to really know what they need to do. It's more far-reaching. It's more far-reaching, and we are happy that in many of these underserved areas now have internet access.
You're watching the Platinum exclusive on TV Platinum. I am Oluwatobi Elieton. This program brings you one-on-one conversation with the people shaping Nigeria's future. And in our studio today is Dr. Binyere Ukare. She is the director of the Family Health Department at the Federal Ministry of Health and Social Welfare. And she's here to discuss Nigeria's health priorities, maternal and child health, and the government's drive towards ensuring improved family health outcomes. Thank you so much for joining us today.
Thank you very much for the opportunity.
Now, to start with, tell us what health promotion actually means to you.
Health promotion refers to all the, I would say, activities, all the actions, all the information, services, and even products that are deployed to empower the people, the population, with the right information, knowledge, skill to take care of their health, to be in charge of their health, in terms of making the right healthy choices, making the practicing the health, right actions, and ensuring they have the healthy lifestyle.
And how can this shape Nigeria's landscape with what we currently have?
Certainly, by the time you're ensuring a country is ensuring adequate health promotion interventions, building up the information level, the knowledge level, the skill level, and of the populace, you gain what you call good population health. And when men, women, children, adolescents, elderly in the society are healthy, that means a productive society, and that ultimately is going to lead to human capital development and sustainable development for that country. They'll be able to meet even their GDP and all that. Yeah.
Tell us about the Health Commemoration Day.
Oh, today is the National Health Promotion Day in Nigeria. It is a very pivotal point for us. Today is the second time we are commemorating it. Nigeria was the first to declare this National Health Promotion Day in the whole of Africa, in fact in the whole world. And we are very excited. This was done after the National Council on Health made that resolution, and it was declared 29th of October last year by the Honorable Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate. So it's a great achievement for us, because it's a day that gives us opportunity to call the entire nation together, all the key stakeholders, the partners, governments at various levels, to create great awareness and remind ourselves again of our role, and a very, very vital, important role on preventive health, on promotive health, which actually reduces most of the money that we'll have to spend on curative health and give us a healthy nation that will be very productive.
So with the kind of landscape we have in the country and how diverse our culture is, how do you think we have been able to integrate this into the everyday life of the ordinary Nigerian?
I must say that we are doing a lot, and you know that Nigeria is a huge country with a huge population, and the Federal Ministry of Health has been on the drive, and through the Health Promotion Division in the Department of Family Health, and together with all our stakeholders, our development and implementing partners, we've been able to come together, and we have the National Health Promotion Policy from the federal level, which is there to provide strategic direction for implementers all over Nigeria and at all levels, be it state level, local government level. And so this gives us the right direction and helps us to know what to do. And Nigeria, the Federal Ministry of Health has yearly made appropriation for health promotion interventions, even though we always receive complementation from our partners for it to be able to have wide enough awareness creation, because a lot of health promotion interventions borders on creating huge awareness and ensuring, and this awareness, you have to do it over and over continuously for our populace, for our people to really know what they need to do to prevent diseases, what they need to do to promote their own health, because health alone cannot be provided by the medical practitioners or all those in the healthcare system. Every individual has a role to play. Every community has a role to play to ensure the good health of people. And also, through the policies, we're even giving it a multi-sectoral approach, bringing in other sectors. Education, health promotion should be taught in our schools. How about housing? Houses should be built in a way that there's cross ventilation and people are not jam-packed in a small place that encourages transfer of communicable infectious diseases. And other sectors should be brought on board. How about nutrition? What do we eat and all that? So it's a multifaceted approach indeed. And over the years, we've had quite a number of health promotion campaigns, and we also roll out information, electronic IEC materials to communicate social and behavioral changes amongst the people, and even in terms of seeking for healthcare and all that. This we've been doing, but I must say that we still need to do a whole lot, and it's a collective action, and so we are calling to everybody to join hands with government and ensure that we're able to do more on preventive health in line with the renewed hope agenda of Mr. President.
This is to inform the general public that the Health Promotion Division, Family Health Department, Federal Ministry of Health and Social Welfare, in collaboration with partners, is set for the commemoration of the National Health Promotion Day in Nigeria, with the theme Health Promotion, the Catalyst for Sustainable Health and Well-being of Nigerians. Date 29th October 2025. Time 10 a.m. prompt. Chief host Professor Mohammed Ali Pate, the Coordinating Minister of Health and Social Welfare. Co-host Dr. Isiaq Adekunle Salako, Honorable Minister of State for Health and Social Welfare. Host Daju Kachalom MNI, Permanent Secretary, Federal Ministry of Health and Social Welfare. Convener Dr. Binyerem Ukire, Director Family Health Department, Federal Ministry of Health and Social Welfare. For further information and inquiries, contact the Director, Health Promotion Division, Federal Ministry of Health and Social Welfare, Mr. John Urapa. Health Promotion, promoting healthy choices for healthy lifestyles.
Now, if you look at the role of technology and how it has diversified and demystified a lot of things as we have it now, how can we now bring that into the healthcare system of Nigeria? Considering the fact that, okay, we have rural dwellers who may be in far-reaching areas where you cannot easily get access to that, and how can it be incorporated into their daily living? Yeah,
I think the innovation, the digital world has opened up great avenues for us, and health promotion is not left out. We are tapping into that, even though we still need to do a whole lot more. So there are many social media handles, social media platforms through which the Federal Ministry of Health tries to send out information, and even the other partners to everybody out there, particularly the youth, the adolescents, mothers, issues to do with antenatal, how to care for yourself during pregnancy, care for the newborn and all that, even the elderly. And then we have, that presently I would say, if I would summarize the health challenges we have those that amongst women, children, adolescents, elderly. We also have infectious diseases such as, let's say, tuberculosis, malaria. That we also have non-communicable diseases like hypertension, chronic conditions like cancer and all that. And it's all through health promotion that people can be empowered with the right information. What do I do to stop myself from getting this? And even if I get it, what do I do to reduce the impact, reduce the morbidity, reduce my chances of dying? So there is health promotion at various levels, from even not allowing the disease to occur at all, reducing the disease burden, and even reducing the impact, reducing the consequences, the complications that will come out of it, and also reducing the death rate associated with that condition. And so employing digital solutions is very helpful because it's more far-reaching. It's more far-reaching, and we are happy that in many of these underserved areas now have internet access, and even places that don't have, we say continue our community campaigns, outreaches, engagements of the gatekeepers, the traditional rulers, and also we have our national health promotion champions who set the pace for us and ensure that a voice is given to health promotion practices at various levels, community levels, household levels, and individual levels. Even in our churches and our mosques, there's a huge work to do, and I'm glad that the media is not left out. The media has a critical role to play if we must reduce our death rate, our disease rates in this country, and that is cheaper, is more cost effective for us. And so governments and every one of us should invest a lot more on health promotion, health prevention, strategies. That's what we are talking about today.
Okay, so in the near future, now that Nigeria is celebrating the second year, what advantage does Nigeria have over, let's say, African countries as we have it now? And in the next 5 years, what do you project to be the situation of things?
Now we have, it's good, it feels good to be the first to have taken that bold step. Yes, and lead the way for the entire Africa. And today at the press briefing where my permanent secretary spoke, representing the coordinating minister, she also charged the World Health Organization to look into it and make it a global thing. And so we are expecting that other African nations, countries, will key into this, because the entire world needs to promote health promotion. We need to begin to think on, we need to bring it on the front burner and begin to, fashion it more correctly and how to go about it to achieve effective results. And we need to make more investment. In fact, he said that for any 1 naira you invest in health promotion, in preventive, you're gaining 6 naira out of the cost you will spend curing it. So it's much cheaper. And for a country like us and the entire Africa, where we know that we are not at the highest level, is it not wiser that we do more on prevention than on treatment?
This is to inform the general public that the Health Promotion Division, Family Health Department, Federal Ministry of Health and Social Welfare, in collaboration with partners, is set for the commemoration of the National Health Promotion Day in Nigeria, with the theme Health Promotion, the catalyst for sustainable health and well-being of Nigerians. Date 29th October 2025. Time 10 a.m. prompt. Chief host Professor Mohammed Ali Pate, the Coordinating Minister of Health and Social Welfare. Co-host Dr. Isiak Adekunle Salako, Honorable Minister of State for Health and Social Welfare. Host Daju Kachalom MNI, Permanent Secretary, Federal Ministry of Health and Social Welfare. Convener Dr. Binyerem Ukire, Director Family Health Department, Federal Ministry of Health and Social Welfare. For further information and inquiries, contact the Director, Health Promotion Division, Federal Ministry of Health and Social Welfare, Mr. John Urapa. Health Promotion, promoting healthy choices for healthy lifestyles.
So if you look at what would you say are the most pressing health challenges Nigeria is actually faced with, and what health promotion can actually do to tackle this headlong from what we have now?
Just like we are many, that's how health challenges are really many, and I'm thinking through which one is the highest. Now, look, using data, the mortality rates, the morbidity rates. We will say maternal mortality is high, newborn child mortality is high, and all the others. And again, we're having rising deaths, non-communicable diseases, hypertension, diabetes, a lot of also so many new strains of microorganisms are coming. We're having a lot of that. Last time it was COVID. We're having a lot of infectious diseases. So the disease burden is huge, and all these are going to benefit from health promotion practices, health promotion information products, pushed out there for you and for me, for all of us, to be able to key into and ensure that we do the right things, make the right choices, and live well. Make, with respect to what we eat, what we do, healthy high lifestyles, they will go a long, long way.
Would you say there has been a challenge with data?
I would say we need to strengthen our data. Data has always, it's not yet at its optimum in Africa. And we keep working on it, so we'll continue to strengthen our data, because it's data you use to make decisions. By the time you're having a rising data on a particular health condition, then that means you should do a lot more. If people keep dying, for instance, from preventable causes, mothers keep dying when they are pregnant, delivering, from very preventable things you can actually, very easy to prevent, then that means we need to scale up what we're doing on the from the prevention angle.
Okay, so in the near future, what do you hope Nigeria can actually learn from and actually adopt as a model to say, okay, we've gotten it right here, it has to do with health, and then some other areas that you think is still not being addressed at the moment?
I think one thing we've gotten right here is this health promotion, by Nigeria declaring it, because it's giving an opportunity for the first time to come together and think through. Health promotion is important. It's putting it on the front burner, calling everybody to say, look, we should focus more on prevention. We should invest more on prevention. We should learn more on prevention. Teach our children. They are the next generation. Teach the youths. What do? Teach them. Let them not take hard drugs. When they are young, it affects their brain. And they will not be productive eventually. They will become a menace to the society. They will have mental health issues. You will not enjoy your life. So there are so many. So health promotion is this really one thing we've gotten right. That awareness creation, and we have to put it on top gear. We are just starting. There's a whole lot more to be done. Yes, and through that, I know that we'll be able to achieve Sustainable Development Goal 3, which says having a healthy nation and good well-being of all. Health promotion is key. It cannot be pushed aside. Very, very key, prominent, and the action is for all of us.
This is to inform the general public that the Health Promotion Division, Family Health Department, Federal Ministry of Health and Social Welfare, in collaboration with partners, is set for the commemoration of the National Health Promotion Day in Nigeria, with the theme Health Promotion, the catalyst for sustainable health and well-being of Nigerians. Date 29th October 2025. Time 10 a.m. prompt. Chief host Professor Mohammed Ali Pate, the Coordinating Minister of Health and Social Welfare. Co-host Dr. Isiaq Adekunle Salako, Honorable Minister of State for Health and Social Welfare. Host Daju Kacholom MNI, Permanent Secretary, Federal Ministry of Health and Social Welfare. Convener Dr. Binyerem Ukire, Director Family Health Department, Federal Ministry of Health and Social Welfare. For further information and inquiries, contact the Director, Health Promotion Division, Federal Ministry of Health and Social Welfare, Mr. John Urapa. Health Promotion, promoting healthy choices for healthy lifestyles.
And to the administration of President Tinubu, what has been the goal and how has it fared so far in terms of the ministry's mandates to help Nigerians actualize their health care?
In fact, it's in line with his plan to give Nigerians renewed hope. So for the health sector too, renewed hope in our health sector, renewed hope for you and I to live longer and live more productive lives. And that's one of the reasons why the coordinating minister ensured that this day was declared. And the current leadership also has continued to ensure that through the ministry appropriation, health promotion always gets a vote, and it's not enough. You know, we have a big country with so many competing needs. It's not enough, but at least we appreciate, we are happy that government is doing that. And I know that with what we are doing now, the leadership and even the entire nation, we call on the Senate, houses of Senate and other. With respect to health, more has to be done and more has to be invested into preventive health. Health promotion is a great strategy that we cannot push aside. It's very key.
Your last word to Nigerians or any Nigerian watching to say, like, what do you say to them?
My last word to Nigerians to say that in line with the Nigeria Health Sector Renewal Investment Initiative, health promotion has been well adequately captured, and we want to ensure a multi-sectoral approach to ensuring that we have dividends from health promotion practices in Nigeria. And so I'm calling on all the different ministries, departments and agencies, the MPHCDA and all the education, housing, that we should all put hands together and ensure that we integrate health promotion into our policy documents, not only for the health sector. All the other sectors should come on board, education, environmental, health, sanitation, all that. Come on board. We should amplify and prioritize health promotion. And I want to speak to every Nigerian, every man, every woman. Your health is in your hands.
Thank you so much for joining us on the program.
Thank you.
And that was Dr. Binyerem Ukwaire. She has shed light on some of the progress we are making in Nigeria's healthcare system and what we would actualize in the coming years. Well, join us next time on this same station for the Platinum Exclusive as we bring well-meaning Nigerians to share their policies and programs and how Nigeria can actualize a goal in the development process. I have been your host, Oluwatobi Elito, saying bye for now.